I've got 5 quick studies just to go through, just to show the depth, really. Because, Grant said, I want some new recent studies. So these are all within the last year or two. There's more and more data coming out, really, hugely supportive of plant-based diets. They say it takes, 17 years for the raw science to actually get into medical practice, but you can jump the gun, so you can do it now. I mean, a lot of people obviously are, but we can spread the word. So the first one from the JAMA, from the generally the American Medical Association, diet types and mortality risk. Systematic reviews are the highest sort of tier of studies. They're studies of the studies. They pull all the data and the types of studies, and there are different methods of doing it. And it's pretty meticulous, tedious stuff. So, but we always look at, people analyse the way it's done, but getting to the conclusions. The question for this one was, what is the association between dietary patterns followed and all-cause mortality? This is from the UK Dietary Guidelines Advisory Committee. So it had 153 articles and one RCT, randomised controlled trial. And they found 72% of these studies examined diet pattern and quality using dietary indices. So they split it up and analysed them by the types of diet, including the Mediterranean, DASH diets, vegetarian and vegan diets, etc. And the overall summary findings improved all-cause mortality, that's supposed to say. So that's from cancers, heart disease, etc. Associations with higher intake of veg, legumes, fruit, nuts, whole grains or cereals, fruits or seafood, lean meat or poultry when meat was included, and unsaturated fats in place of saturated fats. So they're more the plant fats rather than animal fats. Lower intake of red and processed meat and meat products, high-fat dairy, refined grains, that's processed foods, added sugars, sugar-sweetened beverages, solid fats, saturated fats, trans fats, and excess sodium. So it's exactly what you'd expect, but these are, these systematic reviews are big analyses looking at pooled data, so it's very strong evidence. 5 of the studies examined plant-only diets. The Adventist Health Study 2 and the Nurses and Health Professionals Follow-up Studies, these big, well-known, there's probably 10 of them in the world, studies that are ongoing, have been going on for decades. And 2 studies show greater adherence to the healthy plant-based index was associated with all-cause mortality. So it can be assumed that healthy plant-based diet that avoids all animal foods may also be associated with improved longevity. We need more studies, obviously, on 100% plant-based diets to be certain, but the evidence is accumulating. The second one on mortality, and then dividing it up into healthy plant-based diets or unhealthy plant-based diets. The US Haynes study, so National Health and Nutrition Examination Survey, it's a very well-known ongoing study as well. So 40,000 people, 5,000 deaths over 8 years, and they divided the diet up. So lots of these studies are now dividing it up into a plant-based diet index. So HPDI, UPDI, so healthy or unhealthy plant-based diets. Healthy is things like whole grains, legumes, fruit, vegetables. Unhealthy are white flour goods, processed goods, sugar-sweetened beverages, baked goods, all those kind of stuff. Stuff that, because lots of plant-based diets lots of plant-based foods are unhealthy for us. So a lot of processed and junk food are actually come from plants. You have to remember. So this looks at, this tries to drill down into what aspects of your diet is actually healthy. And it showed there's a mortality benefit for all plant-based diets for total deaths and cancer. So the hazard ratio, those HR things, when they're under 1, that's it means it's beneficial. I haven't put confidence ranges in there, but they're all got good p-values and within the confidence, 95% confidence intervals. Mortality benefit for healthy plant-based diets for total deaths, but a detriment for unhealthy plant-based diets and cardiovascular disease. So the HR goes over the one line, so 1.3 and 1.42. So their summary was increased intake of a plant-based rich diet in healthier plant foods is associated with low mortality risk, whereas a plant-based diet that emphasises less healthy plant foods is associated with a higher mortality risk. So you can't be a junk food vegan and get away with it, is the bottom line. You've got to eat those raw foods, as close to, I'm going to come to what a plant-based diet is later, but as close to nature as an unprocessed, so retaining the nutrients, not adding crap, and not losing lots of important stuff. So the next one, plant-based diets and risk of diabetes. So can moving to a plant-based diet reduce your risk of diabetes over time? Again, the nurses' health studies and the health professional studies, over about 1/5 people assessed at regular intervals. They do these diet questionnaires. So we'll send them regularly, every 3 months or so, a questionnaire to fill out what are you eating. And again, they split it up into healthy and unhealthy plant-based diets. And as you might expect, the higher plant food, lower animal food diets reduced the risk of diabetes, and the healthy plant-based diets had a much greater reduced risk of diabetes of 34%, but the unhealthy plant-based diets increased your risk of diabetes. So you just can't get away with eating the junk food, Peter. You can't stop at the Z stores and have your. But you got. You're picked on tonight. We don't used to celebrate it. So Peter, I mean, you're quite open with your story. You had an operation recently, didn't you? And your diet went slightly off track, I think. And then your HbA1c, your diabetes measures, actually crept over into the pre-diabetic range, which was quite a surprise for you, following a plant-based diet. But then you've very well managed to reverse it, haven't you, over just a few weeks or a couple of months or so, was it?
Plant-based diet.
Mm-hmm. And it's the same for all of us. We're all bombarded by this obesogenic environment, by terrible foods all around us. And we've probably all of us here got something about us to stick to a healthy diet. Whether it's a mental thing or education thing, it's not easy. We're constantly going to the supermarket. The first stuff you'll see is crap. So look, overall, basically, the more you move in a healthy plant-based diet direction, the better. And the more if people who kind of let their diet drift, their risk of diabetes just went up over time. So really, these studies are excellent. They're really, drilling down to what people are eating and the differences it makes over time. So just a couple more quick ones to go. So plant-based diets and cardiovascular incidence. So another systematic review. So high-level study. Lots of vegetarian and vegan participants. But unhealthy plant-based diets increase the risk of cardiovascular mortality when they analysed them as a subgroup. Going over the hazard ratio, 1.05 there. But healthy plant-based diets had a decreased cardiovascular incidence. Because it's hard to do studies, prospective studies going forward, so a lot of these studies are looking back at what people have eaten in the past. So that's basically, you want to be eating the stuff on the left, not the stuff on the right. Even though probably a large portion of the plant-based vegan movement, the products on offer, people think it's expensive stuff like that, sort of processed foods on the right-hand side. And what we should be eating, or what we are eating, hopefully most of the time. And the last one, so this other systematic review from Nutrition Reviews this year. So these are probably the top 5 papers over the last sort of 18 months. Assessing the effects of vegetarian, vegan and whole food plant-based diets. All 3 diets showed better outcomes than healthy omnivorous diets, such as the American Heart Association and American Diabetic Association diets for multiple endpoints, so weight reduction, lipids, cardiovascular endpoints, blood pressure, insulin sensitivity, etc. And they say, look, it may stabilise and even reverse type 2 diabetes and cardiovascular disease. And the other thing at the bottom there is, are these diets acceptable? So they do these studies or they assess people, and can people actually in practice stick to them? And people following the Ornish diet, they do these interval assessments and they definitely can stick to these diets because you feel good, you lose weight, you're looking good, and once you get the hang of it, it becomes second nature. So these diets were found to be acceptable and sustainable over time. Because that's the worry with these, they do these studies and look at what people are eating and then they fall off the study and then go back to something else and they can't sustain it. But it was found to be sustainable. And look, all these organisations around the world are recommending a plant-centred diet, including our own Ministry of Health, Heart Foundation, all these major organisations. It's just not enough people are following them. If I was I thought about doing public health for a while. I'd bash my head against the wall because you do all these amazing analyses, you put out these great policies, and you just can't get past the food lobby industry or political interests. Someone told me about how they got the latest American food guidelines, and they sat everyone in a room, came up with a plant-centered type of diet, and then industry came and dampened it down, said no, we can't. We've got to keep dairy in there. We've got to keep a decent amount of meat. So that's a problem bigger than this room really, but it's concerning. But it is actually recommended by people in the know in the health professions. And at this point, I'd like to bring up this case study. So there's lots to talk about data, and it kind of gets a bit dry. It's nice to actually hear from someone. So this is quite a difficult patient actually. In his late 50s, it's pretty young really, playing football I think on the Domain there it looks like. Perhaps, it's great he's out there running around, but perhaps carrying a little bit of extra weight, bit of a high cholesterol, this is going back to 12 years or so now, raised LDL cholesterol above the target range, you can see the target range is in the brackets there. And then out of the blue really, had a heart attack in 2010, had a procedure, had stents put in, but came across a plant-based diet. And if you look at what happened over time with his weight, his lipids, his cholesterols, his LDL cholesterol, that won't let me, I'll do it on this side. Pre-heart attack, weight 72, which was for his height is in the overweight category. 3 months after changing his diet, so his weight started to go down, and then about a year and a half after, his weight's come down significantly. And the same with his total cholesterol. Look at that. The only way you can do that, you can do it two ways. One, you can go on a whole food plant-based diet and not eat lots of saturated fats and things that, highly processed refined sugars and things that put up your cholesterol. Or you can take a statin for the rest of your life. Which you may or may not enjoy, and I know for a fact this chap didn't enjoy taking them. And there's nothing as powerful as personal stories. Certainly, it was profound for me. I leaned out a bit. I wasn't massively overweight, but I was, a bit podgy. Gut health wasn't great. Maybe skin and things growing up weren't great, but it's a really powerful thing to hear people's actual stories, and this is what gets me up in the morning and keeps me talking about it. So Grant, do you want to just say a couple of words, just really about the changes it made to you and how you felt about it?
Yeah, that's me up there, and that other photo of that very fat-looking soccer player was also me. I wasn't trying to lose weight, but I lost 10 to 12 kilos. I'm around about 62 now. That's a little bit under what I am at the moment. And my cholesterol has been lower. It has been down to 3.2. But the old vegan junk food is sneaking back, so I have to start putting it back again. I am angry because when I went to hospital, I thought I was following the best diet. In fact, my doctor told me I was following the best diet. And I wasn't. It's as simple as that. And if I'd known, I hope I would have taken notice of it, and I would have changed my diet, and I would be a healthy, I'm 70 just by the way, just turned 70 a few weeks ago. I'll be a healthy 70-year-old. Well, actually I am a healthy 70-year-old because that's me there. I regularly run, I run about 10 to 15 Ks a week, I run park runs as well. It's all fun. I've had a few mishaps along the way, even since I've been on the whole food plant-based diet. I had a fall 2 years ago on a run, which ended me up in hospital. I ended up with an ICD in my chest, so I've got that as well as the 4 stents now. And I can give you the whole backstory. In fact, if you want the backstory, get this here on page 21, is the whole backstory. So there's
watch the film.
Or watch the film. I also made the film The Big Fat Lie. It's been out for a few years now, which also tells my story, as well as my journey to try to change the world, which I'm still trying to do, by the way. I totally recommend the whole food plant-based diet. I think it will save, or give you an extra 10, maybe 20, could be 30 years of life. And the good thing is, it's active life. I'm still out there running. I've got a sore knee, but I still go out there and run.
Yeah. And what age were you when you changed your diet?
I changed my diet when I was 59, actually. It was exactly 1 year after I had the heart process. I went to hospital and ended up with the 4 stents. 1 year later, I was listening to the radio, national program, and I heard a repeat program of Dr. Cordwell Esselstyn, who wrote the book. What was the name of the title of the book?
How to Prevent and Reverse Heart Disease.
Yeah, How to Prevent and Reverse Heart Disease. A great book, it's still valid. And the good thing about the book is he's very strong and you've got to be strict on the diet, particularly for heart patients like me. And if you start to fall off the boat, you get punished. And Peter's found that, and I'm finding that, we're all finding that. You've got to keep strict if you want to keep that good health. Sorry, what was your question? I've got your question. But that was the answer.
No, that was it, really. Yeah.
So no, I think it's great.
The Big Fat Lie is your doco. So if anyone's not heard of it, Grant's documentary, the man of many skills, talents. The Big Fat Lie is on Vimeo. Is it on Vimeo? Yeah, iTunes for like a $5 or something, isn't it? Or $5-10 something. Yeah. So it's the movie that Cowspiracy and all these latter ones were built on, isn't it? So it's really good. And it's New Zealand centric. That's what we want. We got that, and we got Milked. If anyone's not seen Milked, the film, or not heard of it, you should watch it. It's really good. It covers all the aspects of the dairy industry, but includes the health stuff. But thanks, Grant. Yeah, it's really, really powerful sort of. Well, we're running out of time. About to get hauled off. Let me just come through. I got loads of stuff. In terms of protein, so people talk about protein. The studies very clearly show that risk of mortality, cardiovascular disease, and cancers is much lower than people getting most of their protein from plant sources, in which it's abundant and sufficient, rather than animal sources. I just want to make a point about that because you hear it time and time again. Lots of meta-analyses in the BMJ, including prospective studies, which are more powerful studies. So let me jump through a few of these. We've got the EPIC cohort studies. We've got the studies on vegan health, the Adventist health studies, and the EPIC Oxford. These ongoing studies about vegetarian vegan populations. So they continually churn out data well in favour of following a plant-centred diet, but not an unhealthy plant-based diet. This UPDI, when they divide up what people are eating, there are lots of kind of vegetarians, vegans on not very good diets, processed foods, just like the rest of the population, and they don't do so well. Diet and COVID, 73% lower odds of moderate to severe COVID with a plant-based diet, 59% lower with a pescatarian diet. So massively, an increased odds ratio with a low-carb diet. So that's interesting, isn't it? Because low-carb diets, you can lose a bit of weight, you can control your blood sugars, but you can run into trouble because of its inherent inflammatory nature. So you had a higher risk of getting a moderate to severe COVID with a low-carb, high-protein type of diet. People should have heard about the blue zones. The blue zones are these healthiest, longest-lived people in the world. They eat a largely plant-centred diet. They've got lots of healthy lifestyle habits, but right at the centre there is a plant-based diet. The Broad study in Gisborne, the best weight loss study in the medical literature anywhere. Amazing what Nick and Luke did down there. Really intensive study putting people on a plant-based diet, people from high needs backgrounds, a lot of Māori and high needs people there. Great reductions in weight that continued beyond the duration of the study, reduction in medications, BMI, weight, etc. But the really cool stuff is the reversing it. So there's really good studies by Esselstyn, Ornish on reversing heart disease, by Barnard on reducing diabetes, again Dean Ornish on reversing or stalling and reversing early stage prostate cancer. Lots of autoimmune conditions respond really well. So everyone's got a different genetic contribution to their autoimmune disease, but a lot of people can get remission or improvement in symptoms. So rheumatoid arthritis and these psoriatic arthritis and lots of these autoimmune diseases that are increasing in prevalence everywhere. That's Dean Ornish, and that's his lifestyle heart trial that you can read about, and his books. So I'll jump through it. That's Esselstyn's, so if people haven't seen it, reversing heart disease. So going over 2 years, no other drug intervention or stents or anything, over 2.5 years, the clogged up artery here, the body is just eating away that plaque, which would otherwise cause a heart attack, and in a quarter of cases leads to death with a heart attack. Not everyone gets a perfect result, it depends on adherence, and it probably depends on your genetic cholesterol subtype particles and other sort of inflammatory things, but that's the thing to aim for, really. That should be the gold standard. We've been to the Heart Foundation and talked to them about this, and they now more and more recommend a plant-based diet, but their take on it was, we can't tell everyone to do that because they will fail and they won't be able to do it. But our point is we need to give them this information and say that you can achieve this, you can reverse it, and that's exactly Grant's point. So look, there's reverse diabetes stuff going on, really good studies by Barnard and people showing better control. A reversal of insulin resistance, which you don't get on a low carb diet. You might not get high sugars, but that's because you're not eating any carbohydrates to actually get your sugars up at all. But you're not actually treating the cause of it, which is the fat which gets into cells and causes inflammation in cells and stops, causes insulin resistance. I'll leave it with one thing. This journal, the International Journal of Disease Reversal and Prevention, I think it's a journal of the future. So it's Kim Williams and Scott Stoll and people have put this together, and they're getting people to categorise and catalogue their stories, a bit like Grant's, of disease reversal, of amazing things like lupus and MS, chronic kidney disease, of autoimmune causes. So look, this is the future of medicine in my book. It's just there's a whole mass of the population that are not party to this information and perhaps not in a position where they can actually change. But by word of mouth, there's a decent number of people in this room, and there's thousands more out in Auckland and the rest of the country. And if we all sort of just talk to people about it and try and promote it and say there is another option, because people are finding this themselves otherwise. So I'll leave it there, because otherwise we'll go on all night and Mandy needs to come on and have a chat.